My name is Luke Yakota. I'm a loving husband, loyal friend and son. But I'm also a nurse. And men in nursing is a very important topic to me, which deserves discussion.
My name is Luke Yakota. I am a registered nurse that works in intensive care in Brisbane, and I've been doing this role for the past 3 years and absolutely enjoying every moment of it every day.
I received good grades in school that allowed me to choose nearly anything I wanted at university, and guess what I chose? I chose nursing. Some people responded well, some people responded with a flat tone, somewhat puzzled and perplexed by not living to my potential. They would often openly query why didn't I choose something more prestigious, such as engineering, law, or medicine. But let's face the reality. If you don't get the support from your friends and family, it's very easy to be boxed into stereotypes and moulds that you would otherwise, the world would want you to be.
My role in the ACN is a emerging nurse leader. I've been in this role for the past 2 years, and also since the start of last year at the last NNF, I was very fortunate to be put into the position of the chair of the Men in Nursing Working Party.
The traditional male stereotypes are telling men that nursing isn't for them, or at least they should strongly consider or reconsider or make sure they choose a specialty that fits the masculinity image, such as emergency or critical care nursing.
My nursing career has lasted 3 years. I know it's extensive, but don't trust me. I'm just loving everything about just what I'm doing every single day. And my family has always been so supportive. I've had my dad, who comes from a Japanese background, and my mum, white Australian, and also my grandmother, who identifies as a first Australian. So with all these different diversities, I've been very, very lucky for them to be supporting from each and every way. The current number of men in nursing at the moment is 11%. And that's great. It's been creeping up because in the past 30 years, it's been in the single or maybe 10%. But that's still a long way to go. There are a lot of men out there that perceive nursing as a great career, but I personally believe that there's a lot of barriers and perceptions which are making them second guess or think maybe this career isn't for them. So the work I'm doing in the college is really promoting how many extraordinary role models we have within the profession and the college already, highlighting those stories and saying, hey mate, it's okay to care. It's okay to care for your family, your society, your community, and if you want to choose a career in nursing, we're 100% embracing of you to join us. Moving with the next step with men in nursing is, it's a very broad and very complex issue, because even though our goal is to promote men in nursing, we have to address the undercurrents of the societal stigmas of what a man is, because traditionally men were seen as a strong, tough, don't show emotions role, not so much caring in an embracing way, but caring through being a provider, which is also needed, but these images haven't been conducive to what nursing has traditionally been seen. So our role within the working party is to make it very normal. It's saying that it's okay for men to care, it's okay to actually want to help your community, it's okay to be in a profession that you actually want to see people's health improve, and be completely okay with your identity of being a man still.
We are not allowing men to be men. We are not allowing them to know it's okay to care that we would otherwise see in young boys. These are natural traits of men that I'm talking about, and it's the same inherent traits that society unfortunately stamps out of most men. This is not only about championing men in nursing, but this is about the profession as a whole. It's about continually advancing nursing while respecting our history and equally advocating for equality for women and men in nursing and beyond.
Patients definitely benefit this initiative, because with any industry, if that be law, medicine, any sector in the world, it always benefits from diversity. I've been talking to colleagues today and they say in their workplace that there are some patients, if that be an older gentleman, that would prefer a man to look after them rather than a woman who is younger or older. There's also women who prefer other women to look after her opposed to a man. But if we don't have this equal diversity in the workforce actually can't deliver what the patients are asking for and actually provide the best support that we possibly can for them.
And we are going to lead the way to promote that it's okay for men to care. Thank you very much.